There are only a few reliable laboratory tests for determining nutritional status. Some blood tests, for example, may indicate advanced healthy disease states. While laboratory tests can provide valuable insights into nutritional status, only some tests can definitively determine overall nutritional status with absolute reliability. Nutritional status is a complex and multifactorial concept encompassing various aspects of an individual's nutrient intake, absorption, metabolism, and overall health. Multiple factors influence it, including dietary habits, medical conditions, genetics, and lifestyle factors. Laboratory tests can help assess specific aspects of nutritional status and provide indications of potential deficiencies or imbalances. For example, blood tests can measure levels of certain nutrients, such as vitamins, minerals, and specific biomarkers related to nutrition. These tests can help identify severe deficiencies or assess specific nutrient-related conditions. However, relying solely on laboratory tests may not provide a comprehensive picture of an individual's nutritional status. Other factors like dietary intake assessments, clinical evaluations, and overall health assessments should be considered with laboratory tests to form a complete understanding. It's important to note that laboratory tests have limitations and can be influenced by various factors. For instance, some nutrient levels in the blood may fluctuate rapidly in response to recent dietary intake, making it challenging to capture long-term nutritional status accurately. Additionally, some nutrient deficiencies may only be reflected in blood tests once they reach an advanced stage, making early detection more challenging. None of them, however, can detect the beginning stages of marginal deficiencies, the time when it would be correct to minor problems before they become significant. Laboratory tests may not always detect the early stages of marginal nutritional deficiencies, where subtle imbalances or insufficiencies exist before progressing to more severe conditions. This is because laboratory tests often measure the levels of specific nutrients or biomarkers in the blood, which can remain within the normal range even when there is a marginal deficiency. Early stages of marginal deficiencies may only sometimes be reflected in laboratory tests because the body has various adaptive mechanisms to maintain nutrient levels within a specific range, even when intake is suboptimal. For example, the body can draw upon nutrient stores in tissues or use regulatory mechanisms to maintain stable blood levels, despite an underlying deficiency. To address this limitation, it is essential to consider other indicators and assessments when evaluating nutritional status. These may include 1. Dietary assessment. Evaluating an individual's dietary intake through food records or diet recalls can provide insights into their nutrient consumption patterns and potential deficiencies or imbalances in the diet. 2. Clinical signs and symptoms. Certain physical signs, symptoms, or medical history can indicate specific nutrient deficiencies. For example, brittle nails or hair loss can suggest deficiencies in biotin or other nutrients. 3. Functional tests. Some tests can assess how well the body utilizes certain nutrients. For instance, measuring blood levels of specific enzymes or markers associated with nutrient metabolism can provide insights into nutrient utilization. 4. Anthropometric measurements. Assessing body weight, body composition, and growth patterns can offer indications of nutritional status, especially in cases of chronic undernutrition or malnutrition. 5. Nutritional questionnaires or screening tools. These tools can help identify individuals at risk of nutritional deficiencies by assessing factors such as eating habits, medical conditions, and lifestyle factors. It's important to note that early detection of marginal deficiencies may require a combination of these assessment methods and clinical judgment by healthcare professionals. Regular monitoring, follow-ups, and a comprehensive approach to nutrition assessment can help identify and address potential nutritional issues early. Therefore, a comprehensive approach combining multiple assessment methods is generally recommended for evaluating nutritional status. This may involve considering dietary intake records, physical examinations, medical history, laboratory tests, and other relevant information to assess an individual's nutritional status accurately. Consulting with a healthcare professional, such as a registered nutrition or dietitian, can help guide the evaluation and interpretation of these assessments. Matthew, the video creator, 83-year-old cancer and stroke survivor who received his Ph.D. at 65, would like you to know his passion for helping others by spreading good health information. Please help by taking a moment to subscribe and like this video.